while coronavirus has grabbed a lot of headlines, it's important to remember that flu season is still in full swing, and it's hitting children especially hard this year.
Yeah, it's disturbing. The CDC is reporting more than 100 pediatric deaths so far. That's the worst season for children in a decade. So with important information for families, we've got NBC News medical contributor Dr. Natalie Azar here. Good morning. You know, we talked last week about how the vaccine this year is a pretty good match for the flu, which is good news.
Yeah.
But why this spike in pediatric deaths?
So there's a couple explanations for that, but the primary one is the fact that we saw this predominance of that B strain we've been talking about for the last couple of months. The B strain tends to be more severe in children. Kids tend to have a more severe illness with the B strain. Two reasons why that can happen. One is that we haven't seen the B strain predominate since like 1992, 1993, so they have no immunity. And the B strain can also present with GI symptoms in kids, so they may not get to medical attention as quickly because they're not having respiratory symptoms.
So people don't think it's the flu.
The
coronavirus, as we said, has been kind of dominating all the headlines.
Yes.
But when you talk about the number of cases and the number of deaths, the flu versus the coronavirus, what do we know?
Right. And the thing is, Hoda, like, we can't minimize the importance of the coronavirus. Right. It is definitely, per the CDC, a public health threat, no doubt about it. But let's just talk about sheer numbers. The flu has already affected 29 million people in this country and has caused over 15,000 deaths. Now, look, this year, the fatality from flu is definitely lower. It's about 0.1%. The fatality of coronavirus is hovering around 2%. So, it's definitely a more virulent bug, no doubt about it. But if we're just talking about absolute numbers, for the vast majority of people in this country, their risk of exposure to flu is much greater than the risk of exposure to coronavirus.
Again, the difference between the cold and the flu. A lot of folks sometimes think that it's the cold when it turns out it's in fact the flu. How can you tell?
Right, Craig. So I think the biggest way to say it is the symptoms can be very similar in terms of, a sore throat, fever, aches, that kind of thing. You think of flu, you think it's much more robust, sudden onset, lots of aches, higher fever. And with cold, you're just generally going to have more of a stuffy nose and that kind of runny nose kind of thing than you do with the flu. But I think it's also important to think about, people are asking, what about coronavirus versus the flu? There, the context is really important because the symptoms can really be very similar between corona and flu, but it's the travel. We say to travel to China. Now, at this point, you could say any travel to anywhere where there's been an outbreak or exposure to someone who has traveled to an area of an outbreak would be the key thing in the history that would make a healthcare worker think flu versus coronavirus.
They say the virus, the vaccine is like about 45%
effective.
So people think, well, why bother? And should they still get it?
Yes. Yes and yes. They should definitely bother, and they can definitely still get it because we are still really in the trenches with flu, and the season is still going to last probably well until May. And the biggest take-home, Al, about the flu vaccine is that even though it doesn't offer 100% protection, if you have the flu vaccine and you still get the flu, it tends to be a much less severe illness, less likely to cause pneumonia, which can land you in the hospital, and even can prevent death, especially in children.
So at the first sign, if your child is sick, I think we all have little kids, they're always sick. Did you run to the pediatrician and get a flu test?
So my son just had B last weekend. And it started with, sore throat. I don't feel so good. 24 hours later, in the middle of the night, I reached over and he was hot as can be. And that for me was the thing. This is it didn't feel like a regular cold anymore. And I took him that morning and he got tested, and sure enough, he was positive. But I think with parents out there, anyone who's taking care of children, know your child. If they're not keeping down fluids, they're getting a high fever, if they're just not acting themselves, take them to the doctor and get tested.
Dr. Natalie.
Thank you, Dr.